Hello, everyone. My name is Taylor Douglas, and thank you for tuning into the second episode of the Next Gen podcast. For this episode, we will be focusing on gaining further understanding of the circumstances that led us to the recent federal level attack on reproductive rights that could lead to the overturn of Roe versus Wade and where to go from here. Cool. Are you ready, Courtney?
Yep, I think so.
Today, our special guest is Courtney Boudreau. Courtney is a monitoring and evaluation manager and gender and violence specialist at Pathfinder. Thank you so much for joining us today for this very important conversation, Courtney. Before we really jump into the full content, do you mind just giving us a little bit more background on who you are and what exactly you do at Pathfinder?
Sure. Thanks so much for having me, Taylor. Happy to be here. So as you said, I'm the monitoring and evaluation manager and the gender and violence specialist, and I work on Pathfinder's Act With Her project. So this project works in Ethiopia and Jordan with adolescents, and it provides them with information and programming related to health, gender, nutrition, and a variety of other topics, and it helps to support them as they become adults. And I'm also working on my doctorate in public health. So I'm at the Columbia Mailman School of Public Health. And in that work, I'm more focused on the prevention of sexual violence against children. And related to this conversation, I also got my master's in public health at Emory University, Rollins School of Public Health, where a lot of my coursework was focused on abortion. And I worked with a great mentor, Dr. Roger O'Shea, and he's a passionate abortion advocate. So he's someone that I learned a lot about and really informs my thoughts on abortion.
Wow, that's awesome. Sounds like you've got a lot going on. So again, thank you so much for joining us today, and super excited to, hit on this super important topic. Just to really jump in and get started with our questions. Obviously, the first thing top of mind that's when this news came out was, what are the immediate changes in abortion access that we should expect if Roe versus Wade is overturned in the US?
Sure, definitely. Yeah, I think that's kind of everyone's main concern with this. And I think that one thing that a lot of people have been great at pointing out is that I think it's important to remind anyone listening that at least as of today is June 3rd when we're recording, at least as of now, abortion is still legal and accessible in most states until the decision is officially made. So that's good to know for anyone who's kind of seeking an abortion at this current moment. But 22 states have laws on the books that would restrict or ban abortion if and when Roe is overturned. And then there are 4 other states that researchers and policymakers predict that are likely to do so as well. So that means there's 26 states where it's likely to become restricted. And most of those states, the bans on abortion are after 6 weeks of pregnancy, which can sort of in some ways be considered a total ban on abortion because so few people know that they're pregnant at that time. Because the way that doctors calculate pregnancy is actually based on your menstrual period. So those first kind of 2 weeks of the 6 weeks of pregnancy, you're not actually pregnant. So you became pregnant kind of at that 2-week mark. So you've really only been pregnant for 4 weeks at that technically 6-week mark. So that's a little bit confusing, but I think it's important for people to know because most people find out that they're pregnant around 4 to 7 weeks of that medical definition of pregnancy. So say someone found out at 4 weeks that they were pregnant, the likelihood that they'd be able to get an abortion by that 6-week mark is really unlikely, considering that they'd have to find out, they'd need to find an abortion provider, they have to find time off from their job, which we know in the US is not always easy, have to find childcare, transportation, depending on, a lot of times there's like only 1 or 2 abortion providers in a state. So they have to travel to the cities. So there's really a lot of barriers in the way. So with these kind of bans at like 6 weeks or really early, that's kind of, you can kind of think of it as almost a total ban on abortion, except for those who are, lucky enough to find out and be able to get an appointment. And there's also, in addition to the kind of restricted abortion laws, there's also certain states that are passing sort of really scary laws that are talking about punishing providers and people who are seeking abortions. So in Arkansas, they are trying, or I think they might have already passed a law where providing an abortion would be a felony if and when Roe versus Wade is overturned. Then in Louisiana, they've introduced a bill which didn't go forward, but that was attempting to consider abortion as homicide. So there's really a lot of scary things that kind of going on legally. But right now, that's sort of the idea is that there's those 26 states where it would likely become heavily restricted. And then in the other states, it would remain legal in accordance with the state laws.
Okay, jumping back to question number 2. Okay, so moving on to our next question, Roe versus Wade being repealed will impact our total society, no matter who you are, just given how intertwined we all are. But, what communities specifically do you think will be the most affected and have the most immediate feeling of this repeal?
Sure. Thanks, Taylor. Yeah, I think you're right that it is something that will affect everyone, regardless of whether you're someone who could have an abortion. I think that's a great point to make. But I think, overturning Roe versus Wade would really exacerbate all the existing inequities that exist in our country, which is unfortunately a lot of them. So I think it will mostly impact people of color, Indigenous people who are members of other marginalized groups, low income people, LGBTQ people who are in rural areas. So those are some of the groups that researchers and policymakers think will be the most affected, but basically it's people who are already marginalized in our society. So people who have more financial or social privileges, they'll be able to travel to another state or to another country to seek an abortion. But as I mentioned previously, there's like all these barriers that people face, whether it's money, finding time off, travel, childcare, that need to be in place. So if you don't have these existing kind of safety nets in place, it's really difficult to be able to seek an abortion out of state. And there is also medication abortion, which is an option, which is very safe. But, there may be potentially difficulties in getting that depending on the legality, but there are some organizations now that provide that by mail. So that's an option. But basically, yeah, so it's kind of like those people who are already marginalized are going to face more difficulties. And then kind of in addition to that, the fact that people might have to travel would also make it more difficult for people to keep their abortion a secret. So in cases where the person is like an adolescent or someone who's in a domestic violence situation, they might not be able to travel to seek an abortion without revealing to, their unsupportive parents or partner that that's what they're doing. So that's another group that would be affected by these restrictions. And I think, these are kind of the impacts of seeking the abortion, but then there's also these marginalized groups will also be more impacted by being forced to continue their pregnancy. So, for example, there was a recent paper that came out that found that abortion bans could lead to an increase in maternal mortality among all people, but that it would be a 33% increase. The highest increase would be among Black women. So I think kind of thinking about how there's already such high maternal mortality among Black women for a variety of reasons, including the systemic racism in our country. So I think, thinking about the existing inequities and how those will be made worse by if this is overturned.
Thank you for providing that additional context, Courtney. And, obviously there's a big need to ensure if this is overturned, we're continuing to help out those communities and those marginalized groups as much as possible. Moving on, though, everyone focuses on short term a lot of time when these big decisions are made or they're in the process of being made. And sometimes we lose sight of long-term consequences. But I think we have an opportunity through this podcast and this conversation to make our audience aware of any potential long-term consequences. So, we can all proactively begin advocating for these areas and proactively get ahead of them if we start addressing the long term now. So in your opinion, what are some potential long-term limitations or consequences?
So yeah, thanks for that question. I think that a lot of the long-term health implications of this are really scary. And there's not only health implications of long-term, but also implications just for our society in general. So one of the risks is just that carrying a pregnancy to term is a lot riskier than having an abortion. So it's estimated to be about 33 times riskier than having an abortion. That's an estimate from the CDC. So there's that kind of health risk of forcing people to carry pregnancies to term when they don't want to. Then there's also a negative impact on healthcare that's provided to pregnant people, even when they're not seeking abortion. So an example of that is that for the clinical management of miscarriage, that is the same drugs that are used for abortion. So even if they're not seeking abortion, they're just having, a miscarriage that happens to a lot of women and people who are pregnant, that the drugs that are used for that are the same as those that are used for abortion, so that providers or pharmacists might not be willing to give those in places where they feel like it might reflect on them, or legally they could have implications, even though it should still be allowed under the law. And there's actually, unfortunately, already been reports of this, that in Texas, there were pharmacists who were not providing the prescription to people who are miscarrying. So it's really scary. And there's also, people who are miscarrying, they might be afraid to seek care because it's possible that doctors might assume that they induced an abortion. So kind of thinking about that too, that there might be kind of this chilling effect where they're afraid to seek care from providers because they're worried about what they'll think, even if it's just, a miscarriage that happened naturally. In terms of some longer term impacts, the Turnaway Study is a research study that was done at UCSF, which was done by Diana Green Foster. And it's really a helpful study for us to look at, because what the study did was it looked at what happens when people are denied abortions, when they try to seek one, but they are unable to get one for whatever reason. So it followed 1,000 women over 10 years, and some of them received abortions when they wanted it, and others were denied abortions when they wanted an abortion. And so they kind of were able to compare those two groups, and they had a really long follow-up. So this study gives us a lot of insight into what could potentially happen if and when Roe is overturned. So some of the findings of that study were that denying a woman an abortion was associated with increased financial hardship for years, compared with people who received abortions, which makes sense. We know that having a child is expensive, childcare is expensive, et cetera. Another finding was that those who were denied abortions were forced to stay in contact with their abusive partners. And so for those women that did obtain an abortion, they had decreases in violence because they were able to leave that partner, whereas the women who had the child with that partner had to stay in contact, and they continued to experience violence. Another finding of the study is that, as we know, a lot of people who are seeking abortions already have children. So they looked at the women who sought abortions who had children, and they found that among those who sought an abortion but were unable to get one, the existing children had worse developmental outcomes compared with children whose mothers were able to obtain an abortion and then later had a child when they wanted to. And finally, some of the women who were forced to continue the pregnancies faced serious health outcomes. And unfortunately, 2 of them died during childbirth. So these are some of the findings of the study that I think are really helpful to think about what could happen in this future where Roe might be overturned. And then another major consequence long term is that the impact it will have on gender equality. So we know that the majority of folks who are seeking abortions identify as women. And so access to abortion has really given women control over their reproductive lives and allowed them to make their personal career and educational decisions that they want to. So I think, thinking about that is another really scary piece of this, that it could take away that ability for people to make choices about their own lives and their own bodies. And one study that was done found that for younger women who had an unintended pregnancy, their access to abortion, if they had access, it increased the probability that they finished college by about 20 percentage points, and the probability that they entered a professional job by about 40 percentage points. And these effects were even higher among Black women. So thinking about, just all of these different consequences, the health, society, all across the board, there's really a lot of long-term consequences that this can have. So I think it's important for people to reflect on that as they're thinking about, the future and advocating for access to abortion as well.
Super informative. Thank you, Courtney. Definitely will be checking out that Turnaway study. It sounds super interesting for me to be able to geek out on more research. But moving on to our next question, everyone immediately thinks about abortion when it comes to Roe versus Wade potentially being overturned. But, similar to what you just discussed, there's a lot of long-term consequences that, we wouldn't think of right off the bat. And kind of going in that theme, outside of just abortion, what other limitations on sexual and reproductive health and rights could we potentially see if Roe versus Wade is overturned?
Sure. Yeah, so there could be implications for in vitro fertilization, because states with restrictive laws might consider that embryos are, a person essentially legally. And so that would mean that there would be a lot of restrictions on what people are able to do with in vitro, because generally people have extra embryos that they tend to donate or not use or use for research. So that's something to consider for people trying to start their families in that way. It's that could be restricted. Another thing that could change is access to certain forms of contraception. So that's really scary. I mean, all these things are scary. I don't have to say for each one, but there might be restrictions placed on the contraception. So certain conservative states have already looked into this. So into restricting access to emergency contraception or to IUDs, intrauterine devices. So hopefully that doesn't happen, but it did seem that certain states were already talking about potentially doing that if Roe is overturned. And then finally, there's also concern, around people's access to rights, because this decision of Roe versus Wade is based on the right to privacy. And so if this is overturned, it's possible that this could set a precedent that would allow for other important legal decisions to be overturned, like laws that protect same-sex marriage. So those are some of the potential attacks on reproductive and sexual rights that could continue if Roe versus Wade is overturned.
Thank you. And, moving on to our next point here, we've all definitely heard this one, two, or many times, but it's very clear that the U.S. and its standing globally in the world sets it up to sometimes set themes or, kick off new ideas for other countries to follow. Do you foresee that these increased restrictions on abortions in the U.S. could also play a role or have an effect on abortion access across the entire globe?
Yeah, that's a great question. So I think, a lot of countries are, as you said, influenced by these US decisions and could kind of use it as justification in their countries to push forward some of these laws or rules within their own countries. So I think that, that's a possibility that anti-choice groups could kind of be empowered or emboldened by the US decision to try to push for similar anti-choice policies in the countries where they live. So that's a possibility. And then there's also concern that it could potentially impact funding for global reproductive health as well. So, hopefully neither of those will happen. And there are also a lot of countries where there's been shift in the opposite direction, like in Latin America, there's been a lot of push and more opening of the legalization of abortion in those countries. So hopefully things will go in that direction. But as I said, yeah, and you said, the US does have that kind of big influence on the rest of the world that could have kind of that ripple effect on policies and laws.
Yeah, definitely very alarming. So kind of, jumping back to one of our earlier points we talked about, the first thing people think of with Roe versus Wade is obviously abortion. But I think even, with just thinking about my own education on sexual rights and reproductive education, all of that, I think what it makes this such a big deal is that oftentimes abortion really is the cornerstone of reproductive rights, whether that be because it's, bringing up abortion as an opportunity to explore all the different areas of reproductive rights, or, it's just already such a discussed and conversely debated over topic that then expands people to, learn about the total category of reproductive health and rights. But, in your own opinion, why do we think that safe abortion is such a cornerstone of reproductive rights?
Yeah, that's a great question. I think, fundamentally, reproductive rights is about people having the ability to make decisions about their own bodies. So that I think is kind of the main crux of this, is just that that's our goal within reproductive rights, is to have everybody be able to make decisions about their own bodies and their own futures. And so that's why it's so important to reproductive rights to have that full scope of access. So not only to contraception, but also to abortion, because we know that contraception, even when it's used to its best, the way that you should be using it, it's still not 100%. So really giving everybody full access to their own decisions about their own bodies is really just that crucial part of reproductive rights. And I think that the right to abortion is really what allows us to determine our own paths and our own futures.
Yeah, completely. And so obviously, I think from the pandemic times and just where our world stands today and reflecting on history, it's very clear that there is a power in, the I versus we, and really focusing on the we and helping each other out. So what can our listeners do today and in the near future to help out with this huge problem?
Sure. Yeah. I think it can feel kind of hopeless at times, but I think there is so much that people can do to help. So that's a good way to kind of wrap up our episode, to talk about some of the things people can do to help, because there are a lot of different avenues you can take. So one that I'm sure people have heard about is just donating to your local abortion funds. That's one of the best ways to help. So like I was saying earlier about, the travel costs, finding childcare, knowing how to even set up an appointment, where you can go, where is safe, what the legality is, all of those questions can kind of be answered by these people who work at the abortion funds, and also that they'll help to support financially to help people to seek abortions. So donating to those is one way to help make sure that people still have access to abortion if Roe is overturned. Another that's important is to donate to independent abortion clinics, because I think, most people aren't aware, I wasn't aware earlier about this, that it is the independent abortion clinics that are actually providing the majority of abortion services in the US. So that's a good place to donate as well, to make sure that the clinics that are able to stay open have the operating budgets to continue working. Another is to donate to organizations that are working on shifting laws or providing legal support to people in these states. And you can also reach out to your government representatives and share your views on abortion. I also think, it can be a good opportunity to talk with friends or family members about this issue. And really, I think can be stigmatized, but we know that I think it's 1 in 3 women in the US have had an abortion. So I think it's something that needs to be kind of destigmatized. I think by talking with friends and family about it, it can really kind of open doors and help people to think through their own opinions about it, and kind of help people think through some of these long-term consequences, especially when there's been recent research showing that I think it's like 60 to 70% of people in the US do support access to abortion. So it is something that the majority of people do support. So I think kind of continuing these conversations is really important. And then finally, as I said before, medication abortion is something that's, I think, going to become really more seen and more talked about if Roe is overturned. So kind of getting some more information on that can be good, and learning a bit about how to obtain abortion pills by mail and, what that process would be like can be helpful as well. So that is it for things you can do, but I'm sure there's more. So maybe people can comment on this episode and share what else we can do to support.
Yeah, I love that idea. And, definitely a wealth of knowledge and opportunities that you just provided for all of us. So, at least it's a great jumping point and starting point that can really tailor to everyone's interests. I've really enjoyed speaking with you today, and you've done such a great job covering such a large breadth of information about this very important topic. But, before we wrap up, are there any final messages or things that you want to say to our listeners? Anything that you think you might have forgotten about? Floor is yours. Feel free.
Thanks so much. No, I think just wanted to say a big thank you for having me on and for these great questions. It's great to kind of have the chance to feel like I'm doing a small part in addressing this issue, which has been, weighing heavily on me and others. So I think it's good to just think about it and think about ways to get involved and not to lose hope on this, and to keep fighting for reproductive justice.
Great. Well, thank you so much for joining us today and sharing your insights on this extremely troubling time in American history, Courtney. And thank you, as always, to our listeners for tuning in. To stay up to date on the Supreme Court opinion on Roe v. Wade and other reproductive health news, sign up for our mailing list by going to pathfinder.org/next-gen-advocate. Or if you'd like to get in touch with us directly, shoot us an email at nextgen@pathfinder.org. Talk to you next time. This is not an official Pathfinder podcast, but a product produced by passionate advocates and allies of Pathfinder. All opinions expressed are our own.